So our prototype here, it's made with foam to prevent pressure injuries. We have a lot of patients on ventilators or patients who are just too weak to keep themselves aligned in the bed. And so we always think about ICU nursing, preventable harm. That's our number one thing. Preventable harm. How can we get this person, out of the ICU with as little side effects as possible and back into their life? A one night shift in the ICU, we're just trying to find a better way. And, that was kind of the birth of this FMS wedge. So this, little device here, it helps patients sit up in the bed, helps keep their lungs open. It helps keep by gravity draining as it should. Fewer cleanups, there's fewer risks of injury to them. So it's just inherent with being a patient. So, and it's comfortable, just teamwork, I think. Just knowing that you have somebody who, to call and just bounce questions off of, like, what is this next step? I'm a nurse, I'm not in the business side of everything, and I'm not in the engineering side. I'm just learning, and we're all bringing our own expertise to the table and kind of coming together as a team and meeting each other where we are. And the coolest thing about VCU is so many hands in the pot and so many people coming together from, intensivist doctors who I work with in the MIRICU there, the ICU, bringing me together with folks from the tech transfer group, and then the engineering department here in the college, and everybody kind of coming together. And how can we use this wonderful resources that we have at VCU to get this thing made and, on a larger scale, and just really touch as many lives as we can to help kind of improve that experience of being a patient at VCU.
It's really cool. It's fun to see these solutions essentially already done, and just being able to participate in them is just amazing. So it's really fun. That's why I came to VCU. It drew me to grad school, and it drew me back as a postdoc, and I hope to stay here forever because of that relationship. You can walk over to the hospital, tell them who you are, what you're trying to work on, and they'll connect you with the right people. And they're all eager to help, eager to research and innovate. It's really, really, really refreshing. If we're talking about engineers, it's a matter of flow and drainage. It's really easy to put yourself in that perspective, that patient who's sick, who's having the issues with diarrhea, not draining. Again, normally the engineers, we like to go from the problem solving to the solution. In this case, it was just taking what Emma has done, the awesome work she's done, and just trying to see how we can scale it up a little bit for that next step, that next clinical trial.
We're close to finishing up, have some small batch studies in the ICU, and then hopefully be able to work with some companies and kind of get this thing on the market.
It's nice to see something going to a patient right now. The stuff we're working on is incredibly important. It's got a pathway to get there. It's nice to see that, okay, this is going right now.
And we don't see any difference between our patients, ourselves, our loved ones. I mean, they're there, they're part of our family, so we're giving them the care they need.